recommend getting it checked. And usually, for women at least, when you go get your annual exam somewhere between age 30 and 35, a TSH level is drawn as part of it. Certainly, if you see your OBGYN and you're complaining about changes in your menstrual cycle and your period, your TSH, the thyroid test, is one of the first tests that's done in any sort of reported change in your menstrual cycle, of course, after a pregnancy test. The first test we do is pregnancy test. But if you're not pregnant and you've had changes in your period, we're looking to see if it's your thyroid. If you're wondering, well, how can I help myself and my thyroid? Well, for general thyroid health, we know that the key ingredient for making thyroid hormone in the gland, that hormone that's secreted from the thyroid, is iodine, right? Iodine is critically important and is part of the structure of the hormone. We have learned that, and we know it so much that in the United States, for example, iodine is included in the most basic ingredient that most of us use, which is salt. Now, there's been a trend, of course, in the past 10, 15 years where we're using things like sea salt and all these other gourmet salts. So many of them do not have iodine anymore. And so as a result, that's one way that we've noticed that people are getting less iodine in their diet. And so that's one thing to consider. If you're someone who's decided to cut salt out of your diet, which is fine, if you may be doing it for other lifestyle reasons, keep in mind that historically, at least in the United States, and most actually countries in the world now, that is the way we got iodine into the diet. It was through your food, and particularly salt. It was mandated that salt be iodized. So if you're eating less salt or you're salt-free, then you definitely will need to get your iodine from other sources. Other than that, let's see, treatments for thyroid, things like radioactive iodine is usually used for overactive thyroid. There are medications that help with overactive thyroid. It's important to know that if you are on these medications for an overactive thyroid, example, methimazole, it's not recommended that you use those in your first trimester. So you don't want to use methimazole, you do not want to use carbamazole, you do not want to use PTU, or so in different parts of your pregnancy. So it's important to know, if you're planning pregnancy, to mention this to your doctor if you're someone who's on these medications, because you don't want to stop them cold turkey, but you need to go on a safer version of the medication. Otherwise, surgery, your doctor should know about this if you have overactive or underactive thyroid, especially your anesthesiologist, the doctor putting you to sleep, needs to know about this, and what you've been taking and for how long. And if you're especially like an overactive thyroid, what happened? Did you have heart symptoms? Did you feel like your heart used to race? Things like that. That's important for them to know. And then lastly, we use the word synthetic thyroid hormones like Synthroid, but they're not really synthetic. That said, there are some bioidentical versions out there, and certainly that works better for some patients versus others. The biggest thing I would say is a lot of the bioidentical thyroid hormones haven't been tested or validated in the context of pregnancy. And so again, you've heard me talk about the importance of the thyroid hormone for your pregnancy and the development of your baby. And so even if you're someone who's currently on a bioidentical, if it hasn't been validated, you may want to consider going onto one of the ones that have been validated for the course of your pregnancy and switching back to your bioidentical once pregnancy is done. And a lot of my patients do that too. And so with that,